My name is Professor Ndubeze Okonkwo. I am a biochemist with graduate studies in forensic chemistry. I am internal medicine specialist, a subspecialist in nephrology, which is kidney and hypertension, and also a subspecialist in transplantation medicine, consulting in solid organ transplants such as kidneys and pancreas. This is a very brief presentation or summary of the effect or complications of smoking on an individual. While cigarette smoking is seen as recreational and a benign practice, it is actually very deadly. Arguably, alcohol consumption and cigarette smoking can be seen as the two deadliest poisons known to man in medicine, based on the number of people they kill. Cigarette smoking is an addiction which can be cured using counseling, part of which is spirituality, and medication, period. Oftentimes people don't understand that alcohol anonymous or narcotic anonymous that are used as programs to treat addiction in alcohol or drug addiction are usually programs that are based in spirituality. Cigarette smoking harms nearly every organ in a human body. Most people die from lung cancer than from any other cancer. And cigarette smoking is the commonest cause of lung cancer. If you take a person to stand in front of you and you go from head to toe to look at the effect of smoking, you will quickly see how it affects basically every organ in your body. So if you start from the brain, cigarette smoking is one of the most common causes of stroke. It causes irritability, depression, and anxiety. It is also known to cause aneurysm or associated with formation of aneurysm in the brain. And aneurysm is just like a balloon in your blood vessel that carries the blood around your brain. And when the balloon explodes, you have a stroke. And most often than not, you die. The next will be the eyes. Cataract is caused by smoking, and macular degeneration, which leads to blindness, is primarily caused by smoking. So smoking cigarette causes blindness. Then we go to the nose. Cigarette smoking decreases or reduces your ability to taste things and smell things. Then you look at the mouth. It causes the staining of your teeth, decay of your teeth, and gum diseases. If you go from the mouth, you get down to the heart. Cigarette smoking is one of the most common causes of heart attack, and is associated with all other forms of heart diseases. Still on the heart, cigarette smoking is known to precipitate hypertension because it stiffens up your arteries. And so when the blood is traveling through your arteries, the pressure he exerts is being resisted by very stiff blood vessels, and that makes your pressure go up. And then hypertension leads to all kinds of end organ damage, as you know. Then if you look at the lungs, cigarette smoking is associated with blood clots. When you have blood clots in your lung, a very high percentage of people that have blood clots end up dying, if not caught in time. And even when you do, sometimes you are in an area where there is no treatment and it kills you. Cigarette smoking increases your chance of developing pneumonia as well as asthma, period. Cigarette destroys the airbags that we call the alveoli, which is like balloons in your lung that the air go in. And so for you to breathe, the balloon will expand and you breathe in and it will collapse and then you breathe out. When cigarette smoking destroys this, you have difficulty breathing in the good air and much more difficulty bringing out the bad air. And that is called chronic obstructive pulmonary disease. Another way of saying your lungs cannot support you. And then you would have seen people carrying oxygen tanks when they're going from place to place because they can't breathe by themselves anymore. Without the support of oxygen, they die. And it will continue to deteriorate until such a time that it either kills you or you get a lung transplant. Even going to your mailbox from your door becomes a big task. Going from your bed to the bathroom equally becomes a big task because you can't breathe. Therefore, it is a deadly habit to the lungs. So if we go from the lungs, then we'll come down to the abdominal cavity, and I'm going to touch different organs without details. As you know, your pancreas is what produces your insulin, and cigarette smoking helps in development of diabetes. And if you develop diabetes, you're unable to produce enough insulin to support your glucose metabolism, which means using glucose to produce energy for yourself. And so cigarette smoking is associated with almost 30 to 40% of diabetes, which means that most people that have diabetes, one way or the other, if they smoke, that formation of that diabetes receives some contribution from smoking. If you go to the womb, particularly for women, it causes a miscarriage. And when you're pregnant, it causes prematurity of the baby. And if you have a premature baby, the chance of the baby dying or having developmental disorder or delay is very high. And it makes it difficult for women to conceive. So it causes infertility in women. And then it causes erectile dysfunction in men. So a man who wants to have sex that smokes, most often than not, if you smoke for a long period of time, the blood vessels that you have in your penis will all be sclerosed, which means they have the inability to expand when one is stimulated and the blood is rushing to the penis to cause you to have erection. Those blood vessels are sclerosed, or in other words, the elasticity, the ability of them to expand or contract is lost. And then the patient develops erectile dysfunction, meaning the man wants to have sex and he has difficulty doing so. And that can bring a lot of difficulties at home. The same thing applies to the legs. The blood vessel that supply your legs, the arteries, can also be sclerosed. And so the blood flow going to your legs to supply the muscles will get difficulty to get there. And in so doing, you start developing what is called a peripheral arterial disease, which means insufficiency of blood flow to your legs, leading to loss of your legs by amputation. This number one cause of amputation of your legs is diabetes. And since cigarette smoking is associated with diabetes, it causes you to lose your leg via diabetes, or it will cause you to lose your legs through insufficient blood flow to your legs and your feet and your toes. So it is the second most common cause of losing your legs after diabetes. And you go to the skin. People who smoke, they age very quickly, and then you have yellow nails and a lot of wrinkles. Cigarette smoking is also associated with arthritis. Your joints are desiccated. The blood that is supposed to come to that area, the blood vessels that bring them will be sclerosed, and at the end of the day, you don't have adequate lubrication of your joints through many mechanisms, and arthritis are developed. If you have wounds, like you cut yourself, it is difficult for you to heal because you don't have good blood flow coming to your skin for healing. And then, if we go to the endocrine system and the immunological dysfunctions, what does this mean? Your immune system that helps you to resist infections or developing cancers affected. So by no means will you find one organ in your body that cigarette smoking does not affect. One of the most terrifying things we deal with on daily, year to year, month to month, that cause death is cancer. And cancer brings this fear and nightmare whenever you hear that one has a diagnosis of cancer. So you will pay everyone to pay attention to this, because a lot of cancers are caused or associated with cigarette smoking. So if you start from the head to the toe, you have cancer of the mouth, cancer of the voice box, cancer of the throat, then you have cancer of the lungs, then you have cancer of the stomach, cancer of the pancreas, cancer of the colon, which is large intestine, cancer of the liver, cancer of the womb, cancer of the cervix, cancer of the kidney, and cancer of the bladder. So you can see that if you continue to smoke, one way or the other, it's going to kill you. If it does not kill you by going from head to toe, these that I have mentioned, if it doesn't kill you by stroke, you go blind, you can't smell well, can't taste food well, and then you have bad teeth, bad gum, then cancers of the throat, mouth, down to heart attack, obstructive lung disease, lung cancer, and the rest that I have mentioned. This is just a mere summary, because I also understand that a lot of our brethren in Nigeria have difficulty accessing telephone data. So the longer the video is, the less helpful it is to them. And I hope this will help to encourage everyone who is smoking or who intends to smoke to please take care of yourself and quit smoking, or don't start smoking, because there is nothing that one will gain from smoking other than these bad outcomes that I mentioned. And some people will say, oh, my grandfather lived 70, 80, or 90 years, but he smoked. But the quality of life is seriously affected by what I've just described. And at the same time, your grandfather that lived 90 years or 80 years could have lived 120. We don't know that. In advanced societies today, you see 90 years old and 100 years old driving their cars and coming to the clinic by themselves without needing any help with activities of daily living. So I thank you for listening.